I really hear you on people will do whatever they will do. And I saw that in our case. All the survivors of Dr. Lee with whom we worked, they said it to me and they said it to the jury. They took the stand and they said, I lied to him. You know, I told him I dropped my medication in the toilet. I told him I was leaving for a trip. You know, I paid extra money. I offered him extra money, which he was always happy to take, by the way. The fact is that they took the stand and they said that to the jury, but that jury still understood that the doctor had broken the law. No matter what they were willing to do, he should not have exploited them. He should not have hurt them.
I'm Flindt Andersen, founder of PAIN, Parents and Addicts in Need. I've been in recovery since 2001, and there isn't much I don't know about recovery. And my mission is to constantly tell the truth about addiction, to make the realities of addiction, recovery, and drug culture known, and to drive awareness and advocate change that ultimately saves lives.
And I'm Jason LaChance, a certified recovery coach with a passion for speaking with others and sharing their knowledge to help others seek recovery and maintain long-term sobriety. And this is the Don't Hide the Scars podcast, presented by PAIN, Parents and Addicts in Need. Welcoming to Don't Hide the Scars, Charlotte Bismuth, the author of Killer in a White Coat, the true story of New York's deadliest pill pusher and the team that brought him to justice of what you were part of that. And thank you so much for joining Flindt Andersen and myself, Jason LaChance. We appreciate your time.
You bet.
Thank you very much, Flindt and Jason, for inviting me on. It's a pleasure to meet you.
Great. Same here.
Once I saw the work that you were doing, it was quite ironic is the only word that I could use as I was doing more reading about recently the news concerning Matthew Perry and the arrest. And I came across your work through that because I have a very inquisitive mind in reading. And your take, it seems that we haven't learned much from the opioid crisis.
Absolutely. And it's breaking my heart. You know, it's 10 years from the date that Dr. Lee was found guilty by a jury on most counts in a very hefty indictment. 10 years after his sentencing, to see the news now about Matthew Perry, and specifically, you know, complex issue. I'm sure we'll discuss it more about, you know, how the criminal justice system responds to this. But I was so profoundly upset by the text messages from the doctors, to see that there are doctors still out there who are able to dehumanize and stigmatize people to that extent and exploit their suffering. It really made me sick. And hard to believe. I mean, let alone the number of people who die each year now. We, you know, at the time we thought 40,000 was, how could we survive that as a nation? And look where we are now.
Look, there is so much to untangle in all of this mess. Jason's absolutely right. Both of you are. We have not learned one thing from that opioid mess and Purdue Pharma, and even before that. You know, we have a tendency in this country to go from, no matter what it is, to go from one side to the other without any balance in between. The last thing America does is balances anything out. And of course, on both sides of that balance is you know, they're extremes, no matter how you look at it. And, you know, as a recovering opiate addict, yeah, I was in that mess, you know, back in the 80s and 90s. And when I tell my story, sometimes people are going, how can that even be true? You know, the amount of doctors that I saw, the doctor shopping, you know, I had 13 offices going at one time. And that just wasn't here locally. I mean, that was pretty much across the valley in the state here. But the mess we created from that, and the lack of speed in which anybody did anything, I think is what shocks me. And you bring that forward now, the lack of speed and what we're doing with the fentanyl crisis and addiction in general and treatment to follow is sad. It's absolutely sad.
That is all very, very true. And right after I said, we learn nothing, and as I was listening to you, I had this thought of, well, there are some things we've done, and we're at that strange point where we need to hold both of those thoughts at the same time, which is we are, every day losing people whom we should not lose, and it's not going fast enough, and there's too much suffering. There have been some extraordinary people, some extraordinary initiatives that I think are game changers. I'm thinking of, Nan Golden, who went up against the Sackler family and, revealed to the world that they were not the philanthropists that they said they were, and that they had profited from the pain of others and got their names taken down from the big museums. And then, we worked together as advocates with her group on the Purdue bankruptcy public education initiatives from that. I'm thinking of initiatives like the Overdose Fatality Review, which is an incredible community-based innovation that responds to overdoses, investigates every death to try to understand what happened, how can they help the families, how can they prevent it from happening again. The Opioid Industry Archive, I'm a member of their advocacy committee. So there, and I'm a relatively new American, but those are the things I love about this country, right? Is there's utter desperation, and at the same time, there are these absolute pros who are putting incredible effort with limited resources to create these initiatives, these great teams of people. And somehow we have to balance that. We have to celebrate that and keep fighting and mourn and accept that we're not doing enough.
Sure. Charlotte, let me ask you this. Do you actually have long-term recovering opiate addicts on any of these commissions or teams that you speak of?
I mean, absolutely. Yeah. So for instance, the Overdose Fatality Review Initiative is, it exists in many, many communities across the nation, and they are funded through grants from the Bureau of Justice Assistance. And what happens is that you have representatives from, treatment community, recovery community, medical professionals, addiction specialists. If it can vary from one community to another, but the nurses from local hospitals or doctors from local hospitals, forensic experts, law enforcement, everybody who is concerned comes together and they do these analyses. And I think they are absolutely crucial because they honor those lives that were lost, but they also gather data. And one of the huge obstacles that we had 10 years ago or more, and that I'm now seeing in countries in Europe where opioid sales are increasing, is that there was not enough data. You couldn't find out, where the substances were coming from, whether it was all the same batch, whether they were coming from the same doctor, whether there were, programs that worked or programs that didn't work. So this is really a way to just increase the transparency and, and they have on their website, they have kits available for communities to create their own. So it's really dependent on who wants to be represented, but absolutely. I mean, I think that's a crucial component, right? How could they do it without that perspective?
Okay, so I'm going to go out on a limb a little bit here because that's what I do. Okay, I go way out on limbs, right? And again, this has nothing to do with you, but my response to that is, and why hasn't anything changed? Because when we're talking about addiction, I've been doing this a long time. Okay, I got 23 years of sobriety. I've been doing this for at least 15 years. I will never claim to know everything about opiates and opiate addiction, but there's not much I don't know, simply because I experienced it and I lived it and I tell the truth about it, because there's not enough truth being told about any of it. And the fact of the matter is that our lawmakers, whoever they might be, doctors, all of them, psychiatrists, psychologists, counselors, therapists, the majority of them do not understand addiction. They do not understand the addict's brain. They don't understand what makes us tick, why we make the choices that we make when we are taking an opioid. I see these programs all over the place, okay? I see it all over the place. But we're not tackling the big issue. We're not tackling why are insurance companies dragging their butts on paying treatment centers? Why are they paying 25% on the dollar? Why are we only giving people less than 30 days for treatment? Why are counties across this country with their behavioral health centers not offering or offering very little inpatient detox, medically assisted detox and residential stays? Because if you call the national hotline on this, you're going to get, because we've done it, you're very seldom going to talk to a live body. They never talk about inpatient, detox and inpatient. They always talk about outpatient. You cannot put a practicing addict in an outpatient program. It does not work, right? As somebody still using something, how are they even going to understand what a therapist or counselor is trying to tell them when opioids do so much to the brain in a negative fashion? Cuts our maturity level in half, wipes out our dopamine receptors, wipes out our serotonin levels, wipes out everything that keeps us normal. And by the way, that takes 1 to 4 years to come back. By the way, most physicians don't even know this. I spoke at a medical conference, I don't know, last year at some point, all right? And 85% of the doctors in that building raised their hands and said, we don't know anything about opiates, other than what they were taught in half a semester in medical school. But now you get into the insurance piece to this. I own a treatment center. It is so enormously expensive to run a treatment center, it's scary. That's number one. Insurance companies, we have a policy that's $242,000 that is owed to us, and we billed it out last year, and we haven't been paid on it because they're doing an internal audit, not on us, on them. The excuses follow and follow and follow and follow. They are always 4 months out in paying the bill that they promise that they're going to pay. If we don't change some of this internal stuff that's going on, we are not going to be able to get people the help that they need. By the way, the city of San Francisco, they've got a $569 million annual budget for substance use disorder and mental health, and a grand total of 57 beds to service over 25,000 practicing addicts in that city. Where's the money going? Almost every county in the country that has behavioral health does not offer, if any, detox and inpatient treatment. It's I call it the hamster in the cage, in the wheel. That hamster just keeps running, got nowhere to go. Mm-hmm. And that's what we're doing in treatment today. It just goes much greater than what everybody thinks it is. And when you have lawmakers sitting in Sacramento, in our wonderful state, that don't even understand where an addict came from. By the way, not everybody was born on the street and peeing in the streets. They came from somewhere. By the way, 93% of our clientele all come from great families, by the way.
I'm certainly not in a position to judge whether a family is great or not. And I think maybe our outside perceptions on that aren't always, reliable.
If you or a loved one is struggling with addiction, please call PAIN, Parents and Addicts in Need, at 559-579-1551, or visit us online at painnonprofit.org. Follow us on social media on Facebook, Twitter, Instagram, and TikTok at Pain Nonprofit. And please subscribe to the Don't Hide the Scars podcast and share with others wherever you get podcasts and on YouTube. And if you would like to donate to PAIN, Parents and Addicts in Need, please click the link in the description to make your tax-deductible donation today and help us save more lives gripped by addiction.
Listen, I don't presume to know everything about anything. I can certainly hear from your voice and your experience the level of anger and frustration that has built up over all your years of personal experience and also professional experience in this area. And I think that speaks volumes. You are, touching on so many different things here. I'm a former prosecutor. There are things that I know about and there are things that I don't know. And if I don't know, I like to do careful research and check my facts. All I meant to say, and I think you and I probably have quite a bit of overlap here, is, we can't afford to take our time because lives are being lost. I do think, though, that it is important to highlight the work that has been done and to highlight the people who are out there helping.
Of course.
I have 4 kids, and I really, for a long time, have lived in fear of having them, be exposed to some of these painkillers by physicians or friends or whatever. And to meet so many families who have lost kids or who have tried to support loved ones through treatment, whether it's MAT or sobriety based, it really, it staggers me that, families that are not affected, we should all be supporting these families.
Yeah.
Because that could be us, and it is us. It's, it's our community, it's our friends. The level of suffering is intolerable. And, I definitely agree. We're not talking about it enough. And I think we're not talking about it the right way. We were speaking earlier about the Matthew Perry case. It's an absolute tragedy. It is an opportunity for us to change the conversation, because it reveals so much enduring stigma, and it reveals that even somebody who had tremendous means could not get the help that was probably within his reach, much more so than for others, right?
Yeah.
And on the insurance, I mean, I'm French originally. I will never understand. I will never understand how health and health coverage can be a luxury, something afforded to, some people over others. And I'm open to discussing all these things with you. I certainly am not disputing any of what you just said. I just don't know about all of it.
I mean, and you saw it firsthand through the case that you outline in the book, and being a part of that case, that ramification. I mean, we are parents and addicts in need, and that is that family unit. And Flint's done amazing work for all the years that he does with a very different style of support group for those loved ones. And I think that that's another area that, and one of the things that really, when I first got to know Flindt, that I really saw where his heart and all this is, and where the anger comes from, is it comes from a loving places. Is it so well. Those families that have lost, they don't get them back.
Right.
I don't. No. That hole doesn't fill. I remember, I had an uncle that, due to his addiction, took his own life because it's the only way he saw out. And my grandma had to live with that for 5 years of her life before her own passing, and just seeing her, that never went away. Right. That never went away. Yeah. And other families that we know and have walked through this door, and people that we know that their kids are relapsing, and it's just scary. Yeah, you make such a great, thank you for that point. Why is this a luxury?
Right.
Why?
Well-
and then in the Matthew Perry situation, he had the means for it to be, and he just found more snakes. I mean, he went from these dealers, however he's getting the stuff before. So now these people that should have been reputable, they were licensed. Well, some of them, I don't think the ketamine queen, per my recollection, no, she was right.
No.
Yeah. But just you brought up the text message. How terrible! Like they basically were like, we got this guy, and all that they could find as of now was what $67,000 that he paid. I'm willing to bet is a lot more than that.
But let me bring this point up as well, and I think you already know where I'm going with this.
Surprise me.
Okay, I'll surprise you. Look, there were a lot of years I really wish that even here locally that I tried working with news stations on let's do that little runner across the bottom of the television, right? That's saying how many opioid prescriptions are being written, right, on a weekly basis. By the way, let's put the doctors' names, because that's we can find those records. Let's put the doctors' names across there, right, that are prescribing, because most physicians that I have dealt with over the years, there's a prescribing practice to them, right? There are doctors that will prescribe 40 Vicodin for a torn knee. They're going to prescribe 40 Vicodin no matter what injury you have. That's their routine. Some are going to prescribe 20. We have doctors that are prescribing 240 10 milligram Norco every month to each of their patients, because that falls under the category in the PDR of we can only take 8 per day. So you do the math, that's 240 pills, divided by 8, that works out to 30 days in a row. What they're not realizing is that you can become dependent on these drugs in as little as 7 days. You're not into full-blown addiction yet, but that's coming soon, okay, if you don't curb that or if you don't stop that. But getting back to Matthew Perry for a second, and this is where, as a former addict, a person that's in recovery, this is where I have to speak the truth about this. I think, first of all, I think all these physicians are dead wrong in what they did. There is no excuse at all for any of their behavior in any of this. But I'm going to say this. When you are in full-blown opioid addiction, we are going to do whatever it takes to get the drug in our system. The number one reason why we don't get clean is we are deathly afraid of the withdrawal symptoms. Now, when we are in that position, I guarantee you, and I'm going to say guarantee, those doctors did not call Matthew Perry initially. Matthew Perry more than likely called them or had an assistant find out where he could get more, because I don't think Matthew Perry was ever clean and sober. Because when I would watch him, when you're in recovery, your facial expressions change, your skin color comes back, your weight just naturally starts to fall off. You're not nervous. You're not perspiring. You're not doing the things that I saw him do in interviews. And it always had me questioning, again, not assuming and not being judgmental in any way, because I've been there. The last thing I want to be is judgmental, but something was not right. I kept saying it over and over and over again. Something is not right here, okay? And sure enough, prior to his passing, I said, he's got to be using something, even if it's a medically assisted treatment drug, okay? There's something not right. And when you're giving an opiate addict an opioid-based MAT drug, it's still an opiate. And that's our love affair. We have that love affair with that drug. It's the same thing as having a physical affair with somebody. And so now he took it a step further. Ketamine, this thing, the other thing. All right. So again, do those physicians need to be put in prison? You bet they do. No question about it. But people need to understand what the addict's role here is as well. All right. It's extremely difficult to get off of any of these drugs. It just is. I'm sorry. I don't know how I did it, to be honest with you. It was all a higher power, let me tell you. Because I was taking close to 80 Vicodin every single day. And I looked like hell. I felt like hell. I weighed 140 pounds at 45 years of age, losing teeth, blah, blah, blah. The story goes on and on and on. It can be done. It definitely can be done. I'm sitting here, all right? But we have to take a look at the big picture here. You know, even a Matthew, look, when it comes to celebrities with a lot of money, they do have that money where they can go into treatment for 90 days or 6 months or a year or whatever it is. Very few do. Very few do. It's 30 days out, 30 days out, 30 days out. For the normal person, even that 30 days is crucial. It's crucial. But there is no cure for this. That's the other thing people need to understand. There is no cure for addiction. It's manageable, it's doable, but you have to work your ass off at it. Okay? And in particular, by the way, I'm clean and sober today. I don't know what tomorrow holds. Now, I doubt it. It's about being honest with oneself. I just had major foot surgery last October. Right? I mean, what am I going to do? What are they going to do? Give me an aspirin? No. This was a reconstructed right foot. Okay. So they gave me a few. I think they gave me 20. Right? My wife gets them. She gives them to me. Once they're gone, they're gone. And by the way, she's going to stand there with a drug test. Okay. About 2 weeks after that, go and pee. All right. Because she ain't going down that road again. By the way, neither am I. But there's people out there that it's so weird, Charlotte, because I used to remember the show House MD. Do you remember that show with Hugh Laurie?
Yeah, vaguely. Yes. Yes. I don't think I ever watched it, but I get the concept.
Great show, by the way. All right. But he was a physician with a Vicodin addiction. Right. And I'd watch that show, and, you know, he always carries a bottle of Vicodin right in his pocket, and he'd pull that bottle out and he'd shake it, and that would send me. Every nerve was firing off in my body because I knew exactly what he was doing. He was checking to see how many, even by just the shaking of the bottle, he could tell he had 4 in there, 5 in there, 6 in there, 20 in there, whatever it was. This is such a complicated mind issue that also goes with this, right? So when I mean that people aren't understanding the addict, these are the things that I'm talking about, okay? That they don't understand addiction. They don't understand that we can get triggered by a sight, a sound, a smell, a car backfiring, a gunshot going off, a street corner that we pass. Because, oh yeah, I used to buy right there, or yeah, there's that doctor's office that I used to walk into 5 times a week, and this idiot kept writing prescriptions for me. You know, the package is enormous, and it's going to take all of us to unwrap that package to finally get where we need to be. But I just wanted to say that again. I'm not judging Matthew Perry because I've been there. I know him without knowing him. You know, but he also had help with that instead of those doctors. But see, here's the other thing. What a lot of physicians do is they simply say, we're cutting you off. That's it. I'm not going to get in trouble. I'm not going to write you any more prescriptions. And the last thing these physicians know about are treatment centers. The majority of them wouldn't know where to refer their patient if they had to. What about doing no harm?
New Perceptions North, the premier drug and alcohol treatment and recovery center in Central California. A full continuum of medically supervised top quality care with programs for detox and patient residential treatment with dual diagnosis, intensive outpatient treatment, sober living support groups, and more. New Perceptions North provides adult men and women with the highest caliber of professional health care, treating each client with compassion and respect in a safe, comfortable environment to begin the process of recovery to proudly create and sustain a life without addiction. Call 559-978-1507 or visit newperceptionsnorth.com.
I think depending on the experience each person has had with the overdose epidemic, I'm not someone with a lived experience of substance use disorder. I'm someone who saw it from a different perspective. And then there are family members who have lost loved ones who themselves weren't suffering from addiction, but who went through what you have described. And for each of those groups, language is so important. I hear that you have a way of speaking about addiction and about addicts and about Matthew Perry that you have because of the way that I imagine, because of what you experience and what you've gone through and what you've seen also as a professional. There are other people that I've worked with who speak very differently about it. Even, the word clean is not universally used. There are so many nuances about how we each see and approach and understand it. I'm just glad that we're speaking.
Yep.
And I'm glad that we're speaking to each other. And I'm grateful that you're sharing this with me. And I want to understand it as much as I can. There are, what's painful about the Matthew Perry case, and I really do hear why you think of it that way. One of the things that came to my mind was, even though as a prosecutor, I understand the need to put it out there into the media that the doctors referred to him as a moron in the text messages. 10 years later, having met all the people that I've met, I also think so much about how painful it must have been for his family and his friends to read that, to read in black and white in, publicly available media, how little somebody thought of this person that to them was so important. And, within the community of people who I think we are all together in, that wants to save lives and, stand by each other, it's unfathomable to think of those people who are actually making money and out there just straight on, preying on people who suffer from substance use disorder. That makes me, as I heard you talking about insurance earlier, I was thinking, what are the things that make me that angry? That makes me really angry.
Right.
I'm glad those physicians are being prosecuted. I think whether or not we prosecute people who sell drugs or who share drugs and it results in overdoses, those are really complex decisions. I actually worked on a manual for the Prosecutor Center for Excellence, where we went through sort of all the factors that should go into prosecutorial discretion. And that's really a case-by-case evaluation. But for doctors, they are the gatekeepers.
Yep.
And to be honest, I really hear you on people will do whatever they will do. And I saw that in our case. All the survivors of Dr. Lee with whom we worked, they said it to me and they said it to the jury. They took the stand and they said, I lied to him. I told him I dropped my medication in the toilet. I told him I was leaving for a trip. I paid extra money. I offered him extra money, which he was always happy to take, by the way. But the fact is that they took the stand and they said that to the jury, but that jury still understood that the doctor had broken the law. No matter what they were willing to do, he should not have exploited them. He should not have hurt them. And I really hear that sense of urgency when you talk about doctors who cut people off. We were very concerned about that when we shut down Dr. Lee's clinic. We were very hesitant because we knew that there were lines on the days that his clinic was open. There would be lines of dozens of people, each with a numbered ticket, waiting to see him.
Right.
And we thought, well, if we shut down this clinic, where are those people going to go? What's going to happen to them? So when our investigators went to arrest Dr. Lee and shut down the clinic, we gave out cards and we put up notices that had treatment centers, local treatment centers, local addiction medicine doctors, a number that they could call to get a copy of the medical records that we were about to seize. And, you know, I know people still suffered because of that. It was, you know, we had to shut him down because we were seeing deaths happening on our watch, and that's not something we can live with. But I hear you. These are, there's no way to win. There's no way to win. And we just have to do the right thing as much as we can. In the Perry case, it's hard because I think reporting on it's really important to report on this case. It's of public interest. We also need to have respect for his family and have respect for his memory. Is there a way to talk about it where we move the conversation forward, where we use it as an opportunity to say, well, let's make a distinction between his assistant and the physicians. Let's talk about what it really means to, what is ketamine and why has it become so prevalent and available? And what is the need that he needed to fill, and how can we address that in other ways? So I think everybody feels to such a tremendous extent that no one's listening. And I think it's fair, because how can we feel any other way when people are dying? I'm, a former prosecutor, and yet I'm a big believer in harm reduction, in medication assisted treatment. I was really heartened by the opening of the Overdose Prevention Center in New York, and they've saved over 100 lives already. My prosecutor friends, whom I respect very much, feel very differently for the most part. And it's tough to bridge those differences. I think, in the community of people who are concerned about the overdose epidemic, there are a lot of different positions that we can take. What are the things that we can do together that can make a change? That's the hard question.
It's really tough, because then it goes back to a situation of, is it short-term harm reduction? Right. Is it a long-term one? And well, then, okay, if someone's we talk about it a lot on here. If it's going to be long-term, are you fully educating this person then on the choice that they're making to be on methadone, Suboxone long-term, and
health risks
along with that, do no harm? Yeah. Are you educating them on the health risks?
Because right now they're not. See, that
to a lot of extent.
There was a 19-year-old girl who went to see Dr. Lee. She had never taken oxycodone before. She lied to him and told him she had. He prescribed her. She left his office $100 poorer, but with a bottle of 30 milligrams of oxycodone. She became desperately addicted, almost lost her life. And when she took the stand, she told the jury, thank goodness I found a doctor who is willing to prescribe me buprenorphine, but now I will be on it for the rest of my life. And she was so young, and none of us know the consequences of that. But I think everybody in that room felt, for her to be so clearly aware of that if she stops taking this medication, she will be at such great risk. I think it really brought home for the jury the potency and the danger and, the horrible breach of trust for anybody to start somebody on a medication like that.
Right. Well, again, our philosophy here, and I can speak for Jason on this one, is there's a difference between short-term harm reduction and long-term. Short-term harm reduction works. Long-term harm reduction keeps us trapped. And if you've got a 60-year-old or older that needs to be on Suboxone or methadone, look, I was on methadone too. It took me 2 years to get off of that by myself because they didn't ever want me to come off of it. I mean, it's like, really, guys, guess what? Sorry. All right. I weaned myself off of it, which was not a smart thing to do because I actually had a psychotic break at one point. But when it comes to these medications, why do on God's green earth do we want to keep a 25-year-old, 30-year-old strapped to a medication, all right, for the rest of their lives? But you have to take this now in two different sections because methadone is totally different than Suboxone. Methadone, right? You're a prosecutor, you know the law. It's run by the federal government, by DEA. You have to go in every day to get your dose. If you wind up in that clinic that you signed up for, you cannot go around the corner to another clinic and get your dose. And let's say you live in New York and you want to go to Florida for a week and you fly down to Florida and you forget your methadone. You can't walk into a methadone clinic in Florida and all of a sudden get your dose for the day. You got to go back home. Now, there's things called take homes. There's all kinds of different things that go along with the methadone. But I guarantee you forget that methadone, your butt's on a plane going home because you won't make it. You won't make it the next 24 hours without it. Now, if you've got a 60-year-old, okay, and let's just take a 60-year-old street person, that if methadone or Suboxone is going to keep them off the needle and keep them off fentanyl, I'm all in, okay? I am all in, no question about it. But when you talk about long-term health risk, especially with that 25-year-old, 30-year-old, and look, let me tell you something. First thing opiates do is they constipate you to death, right? I mean, that is a reality. I had to have everything repaired at one time. You have bowel issues, you have potential heart issues, you have sleep disorder. The list goes on, and more medical studies are coming out telling what those long-term health risks are. But nobody that I know of talks about that when those kids are going into a clinic to get that medication. Nobody ever talked to me about it when I went in there. So it's look, again, for some people, I think it's okay. But my gosh, for a 25-year-old or 30-year-old, I mean,
this 19-year-old,
a 19-year-old, I mean,
how failed,
right? How we failed that person right there, because if she had the
but
right,
she's alive. She
is alive. But if treatment were what it's supposed to be, you can look under treatment conditions, you can detox off of Suboxone. We do it to people all the time, but you do it slowly. You do it over an amount of time, so nobody's going through massive withdrawal symptoms. Because the last piece to this addiction issue is the psychological addiction we have to it. Addiction is as much behavioral as it is a physical addiction. It's what we use, where we use, when we use, who do we use with, what method do we use? Do we smoke it? Do we snort it? Do we inject it? Do we do it while we're watching a television show? Do we do it while we're doing this activity or that activity? It is an unbelievable head game, right? That these drugs play with us. And until we can figure that one out, my gosh, all we're doing is keeping the chances of somebody being on a medically assisted drug for anything over a year, their chances of relapse goes through the roof. Goes through the roof. And after a while, you're sitting there going, what am I doing? This is no different than if I were on the street. I still have to go get it. I still have to take it every day. But the psychological piece to this is just frightening.
Yeah. And what I mean about the failing, that young lady you mentioned, was the opportunity to present to her, as well as all the people that you represented that lived, the opportunity to be able to go in and then make an informed decision on where they want to go from there. I mean, that's what a sad state. I will be on this the rest of my life.
That's
like my
sad.
heart
Well,
breaks for her, you know,
I
and
know.
granted, I'm grateful she's alive,
Sure.
but at the same time, with those other things that come along with it, the negative mental, emotional, and physical ramifications that can come and oftentimes do.
Keep in mind, this was in 2004. Well, actually, she testified, 2014. At the time, it was a miracle that she was alive.
Oh,
Yes.
I can
Yeah.
only
Anything
imagine.
that would keep her alive at that moment
Yes, I agree.
was crucial, and everybody in that courtroom felt it. Hopefully, in the past 10 years, I hope that she's gotten access to increasingly good care.
Yeah.
I hope she's thriving.
Me
She was,
too.
she's a wonderful person who was very, very brave to come forward and take the stand. And, all the people who testified in that case took the stand and really, bared their most shameful secrets, or what,
Sure.
what they felt were shameful secrets. But what they taught us was it's not a personal shame. It's something that we're responsible for to a certain extent as a community, because we let doctors like this get away with it. And then most importantly, let's take it back to the source. You were saying doctors don't even know that they can't cut you off. They don't even know that they need to taper you off the opioids to begin with, or off the the Suboxone. That's because the pharmaceutical companies lied.
Yep.
They lied. Now, this is where I, am also volcanically angry, because
Let it fly,
Let her
Charlotte.
fly,
Right.
Charlotte. Let her go.
So as I mentioned, I'm a relatively new American. I've been an American probably for 15 years or so. I'm from France, and I recently was seeing there was a huge increase in opioid sales in France. And there's a governmental website, where you can see financial transactions between pharmaceutical companies and PR firms and doctors. And I was looking through it, and I realized they're executing on the same playbook. Thousands, hundreds of thousands, millions of euros that are being spent by Grunenthal, by Mundi Pharma, which is the European arm of Purdue.
That's it. Yep.
Yeah, there's a company called Aero Pharmaceuticals that sells a generic form of oxycodone in Europe. And they are buying their way into the doctors' offices, into hospitals. They are responsible for not only the lack of information that doctors have, but then the lies that doctors have been peddled. And and this is why, again, also because I'm not someone with lived experience, I'm not in a position to judge anyone, but also we would not be here but for the greed and the lies in those corporate offices. And to think that now, not only are they doing it again in other countries, but here, the Purdue bankruptcy is an example, but even the Endo bankruptcy, I'm sure you have had your experiences, or know people who have, with Opana, which was devastating.
Yep.
They are dehumanizing the people that they hurt and shutting them out of the legal process.
They are.
So, that's insane. This is a country where if you get hurt because a corporation has lied and cheated and committed federal crimes. I mean, Purdue pleaded guilty on 2 occasions, 15 years apart, for federal crimes. You're supposed to have your day in court. You should be supported, helped. You should have unbiased legal counsel. You should be able to understand which court your case should be in, and understand the paperwork that they sent you. And the way that I have seen the legal system and private law firms multiply the exploitation, and really just refuse to consider how this feels and the real practical and financial consequences for people of doing the bankruptcy the way that they have. That is shocking to me. It is shocking to me. And now they're doing their, they made all that money here by lying about their products. Now they're shutting people out of the court system who desperately need help. And in Europe, they've taken all those lessons and they're doing it again, but better. Now they know how to set themselves up. And it's terrible. I don't know if either one of you saw any of the documents that survivors and families were asked to fill out for the Purdue bankruptcy or the Endo bankruptcy. It's ridiculous. They got packets of 300 pages in the mail in legal jargon. I couldn't understand them. I ended up cold calling a bankruptcy law professor and asking him if he could teach me about bankruptcy law. And then we set up some webinars for family members and people in recovery. And it was, it's, I don't even have the words, let alone people who are incarcerated, whose entire lives were just, devastated by these drugs that made so much money for these people, and they have no access to the court system. They have no recourse. They are considered to be the criminals, the bad ones, and they've just been shut out.
Right. You said something about France and Europe in general with Purdue. If you even go back to the movie, well, there's been several of them about Purdue. That going to Europe was in their plans.
Absolutely.
That was in their plans years ago. And in fact, I think as they started to get into a little bit of trouble, they started focusing more and more on attacking Europe on this. And again, I don't remember all the details to it, but I do remember that in some of the documentaries that I saw. The Purdue caused, what's amazing is back in, I want to say about the mid 90s, when a lot of this was going on, especially up and down the eastern seaboard. California seems to get things last. We do, except for now because of the border and fentanyl coming across. But when I went to treatment in 2001, I'll tell everybody where I went. I don't care. I went to the Betty Ford Center. That was my fourth time, but what are you going to do? But I'm standing there and I'm a train wreck. At this point, and some 19-year-old comes in from Boston, and we're kind of sitting outside smoking, and and I look at this kid and I go, what are you using? And he goes, Oxy, and I look at him and I go, what's that? Okay, and he goes, you've never heard of OxyContin? And I go, nope. And let me tell you something, Charlotte. It's a good thing I never heard of OxyContin, because I wouldn't be sitting here today. But it was here locally. And then, of course, when I started this and did my research, I mean, it was huge here in 99, 2000, 2001, and on. And the damage that drug has done to the world. And for Purdue to just get, fined, which basically they could pull it out of their front pocket and pay the fine, is like, it's just ridiculous.
No, it really is
ridiculous. Yeah.
What's very insidious about it is at that time period. So the first guilty plea was in 2007. That was the West Virginia case. But at that time period in the early 2000s and then afterwards, they were trying to curry favor with law enforcement. So they would try to pay for conferences. Law enforcement conferences. They would do these so-called partnerships to prevent pharmacy thefts. But of course, it was always geared on things that would shine the spotlight on criminal activity caused by people, or perpetrated by people who had taken their medication, never on the origin. Right. And that is that's also what they're doing in Europe, is that the language, it's that's not just stigmatizing. I think it's aggressive language of, they call it narcovigilance. So they have to be, they're saying, watch your patients. Your patients are abusing the medication. Your patients are misusing the medication. There's this sort of assumption that if anyone's going to do anything wrong, it's going to be the patients. And, they've learned that from what they did here, right? Which is that human beings are so prone to judging each other that if you tell them that this group of people is going to have this character flaw, you can do anything as a corporation, and it's not going to work. And it's why, it also makes me very angry when I'm in France and I talk to people about the risks of, the pharmaceutical marketing and the opioids. They say, well, that's the United States. That kind of thing could never happen here. That's not true.
That's not true.
That's not true. That's,
human beings are human beings.
They are, but again, it's taking advantage of that human tendency to, judge other groups or stigmatize other groups, to think that you're better than, that there's something different about you. They don't know what's coming. We know what's coming.
Right.
And, that's the other reason why I think it's important to celebrate there's little progress, but these innovations, the people who are fighting so hard, like you, like my friend Ed Bish, like, so many other people who have been fighting for decades. You're the ones who can prevent them from doing it again. And I just wish that people would listen.
Yeah. I got to tell you this. This was a few years back, obviously, but I was speaking to a group of businessmen in another city, and I don't know if you've heard this one, and I got stuck at the first table, and I had a couple of physicians sitting there, and they were just kind of ribbing me a little bit about what I was going to talk about, and one of them was just so arrogant, and I don't do well with people like that, and so he's sitting there, and I looked at him and I go, I swear to God, I look at him and I go, tell me, I said, doctor, I said, why do you guys, the majority of you, overprescribe so much? And it just threw him right off of his chair. Okay. And this guy leans back in his chair, and he leans forward and he starts to giggle. And he says, it's simply because we're tired of hearing our patients bitch. He said, so we're just going to load you up so we don't have to take any more phone calls. And I turned to him and I go, wow. I go, isn't that special? I said, let me tell you something. I said, why don't I do this? Honest to God, I said this. I go, I'm going to come in every day to your office, and I'm going to give you eight 10 milligram Norco to take, because it's legal. And I'm going to do that every single day for 30 days in a row. Then I'm going to walk into your office on the 31st day, and I'm not going to give you any more. And then I said, now I'm going to see how you feel. And his jaw just kind of dropped. I got up, made my speech, and of course I was never asked to come back, and I didn't care. Okay. But seriously, it was like, I can't say that.
Well, you could, but you won't.
But I could, but I won't. But it happens.
Filter,
pre-filter. Yeah, we got to filter some stuff out here. But no, Charlotte, I think the other thing is, when it comes to Purdue, and it comes to these physicians, and the arrogance is so great. The fact that they think that they can't be touched, and nothing is going to happen to them, or it's going to take years for something to happen to them because they have medical degrees. Let me tell you something. Most opiate addicts, this is a proven fact, most opiate addicts are fairly intelligent people with high IQs. You know, there's a lot of reasons why we use to begin with. A lot of it is slowing our brains down because they're going a mile a minute. You know, there's numerous reasons, but the arrogance of the Sackler family is just, it's about as disgusting as it gets, because they know more than likely they're just going to pay their way out of it.
Well,
You
they
know?
hope so. Hopefully we'll make that, we've made that a bit more difficult for them, but yes.
Absolutely.
And, you know, I think now it's extended to, I would say, much of the bankruptcy bar, many of the big law firms, a lot of other companies that do, you know, the administrative work for these big bankruptcy proceedings, they're all making money.
Sure.
And they've all been paid. They all get paid monthly when they submit their bills. None of the families have received a cent.
Right.
And even when they do, it'll be nothing, not even, you know, not even close to what they need. So they're, you know, what's stunning is that there's this willingness to sort of stretch the rules and innovate in the law to keep these corporations on sort of, you know, the best life support that they can get, to do anything possible to keep them in business. And but that doesn't exist for the families.
Right.
And, you know, and there is a tremendous arrogance to that. There's a tremendous arrogance to that. It's visible in so many ways. You know, hopefully the recent Supreme Court decision, the setback for the Sacklers who didn't get their the immunity that they were trying to force. Hopefully that'll result in a more fair deal, but you know, I'm not that hopeful. I mean, Endo learned a lesson from the Purdue bankruptcy, and what they did is that they put in the paperwork, the fine print at the bottom. If you agree to release the executives from civil liability, you know, you'll get a little more money, and if you don't, you'll get less.
Yeah.
But they actually, first of all, they never tell the families what they're eligible for to begin with, and they don't, you know, who's going to make that choice? Who really is able to understand what that choice means? And what happens is that all these decisions that were made at the corporate level to lie, to spend the money on these advertisements, to pay kickbacks to the doctors, it's like they were made by a sort of faceless corporate decision-making system. But there were people sitting at desks who made those decisions. And we need to know who they were.
Sure.
And we need to know where they're working now. And they should not be allowed to work in healthcare anymore. And they need to be held accountable for all those decisions they made. And you know, it's stunning to me how, you know, people who've suffered from substance use disorder are expected to be so accountable about their own actions. The bar is so high. I can't even imagine the pressure that must feel like, to feel like you constantly have to be so honest about, you know, what you did and what you're doing. And meanwhile, on the other side, there's no accountability. There's no expectation. There's, and you know, there's nothing to lose.
Yeah.
There's nothing to lose.
But in our own recovery, look, it's first of all, the world knows what I did. The world knows what I did. All right. And that was important for me to get that out. And I know it is for this young man who I totally respect sitting to my right. You know, it's part of what we do to maintain our sobriety.
Mm-hmm.
But I absolutely agree with what you said.
I mean, the work that you're doing is work that some of the richest, most powerful companies in the world and their executives are not willing to do, that nobody expects them to do. And it, you know, I'm in such awe.
Well, thank you.
Of the daily, you know, the daily work of that self-awareness and accountability.
Thank you.
I really am.
Thank you. I appreciate it. I know he does as well.
Very much so.
Yeah. Very, very much so. In fact, yeah, I'm just about ready to lose it.
Yeah, it kind of triggered something really
Man,
emotional
I
in me
never,
that
I never dropped my head on this show, but I did just then. Yeah, but again, it's important. We do it for a reason. We do it because we care, you know. But by the way, I love going to bed at night knowing that I did this, right?
Yes.
I sleep well at night knowing that no matter what issues I have or what problems I have, nothing will ever take me back to the hell that I came out of, ever. You know, just I can't do it because when you're talking about addiction, and especially now that I'm at the age that I'm at, I don't have another recovery in me. It's too hard. It's too hard. I've told people if I ever go back out again, I won't be back. You know, and plus I just won't do that to friends and family and that no. Yeah. I'd rather the good Lord just take me right now as is, you know, because I won't put others through that nightmare ever again, you know.
Sharp, before I ask about, you know, the book, how people can get it and kind of give us a little synopsis to entice, because it is on Audible, I believe, so I'm going to get that added.
Thank you. Yes. So it was recently published in paperback, which was exciting because I had an opportunity to write a foreword to sort of think about what's happened since the trial. And, you know, one thing I said in the foreword was, we've become so numb to the numbers, but if we had to go around to the homes of all the people that we would lose next year and tell them, you know, that they're on the list, would we see it differently? And how can we, you know, what are the concrete steps that we can take to save lives? So, you know, it's bittersweet. I mean, I wish it weren't still relevant.
Yeah.
I really do. But I think that there's still so many important conversations to have. The book is available everywhere now. Amazon Bookshop, which is the independent bookstores. You can order it from your local bookstore. I'd be so honored to hear from readers. I love hearing from readers. You know, the more different perspectives I hear, I value all of them. And you know, I sort of sit between law enforcement and you know, activism, and I have around me people who have very different political views and different positions on harm reduction or MAT or, you know, all these things. But what really amazes me all the time is how much these people care.
Yep.
And how hard you're fighting. And I really, really appreciate that. So anybody who takes the time to read and respond, you know, I'd be grateful.
You'll be hearing from us.
Good. Please.
And I'll have
I
the
would
link
love to.
there in the podcast description. And boy, we didn't even get into like legislative stuff and how that is, because while
We'll get you back, will you come back?
I would love to come back. And I'm sorry, I will just add the book is really about the team. It's about the people who are brave enough to take the stand. It's about the parents, and it's about my incredible team, Joe Hall, John Courtney, you know, Bridget Brennan, all the people who devoted years of their lives. And that is what it takes to do this. And we can do it. It is possible to hold people accountable.
I agree. Yeah, next time we'll talk about what I call the mayor of Amityville. You ever seen Jaws?
Oh gosh, I cannot. I can't. I know my limits.
Well, there's a scene where Richard Dreyfuss lets the mayor know you can't open for the 4th of July because there's this shark that's eating people up, and he makes all these excuses, and he goes, oh, you're just going to ignore this thing till it comes up and personally bites you on the ass. And so that's my analogy for legislators in this thing. So we'll save that for the next conversation.
Yeah. Thank you, Charlotte, very much.
Thank you both so much.
You've been wonderful, and I've thoroughly enjoyed this conversation. And yes, we got to have you back to keep going on this.
I would love to, and I wish you both all the best.
If you or a loved one is struggling with addiction, please call PAIN, Parents and Addicts in Need, at 559-579-1551, or visit us online at painnonprofit.org. Follow us on social media on Facebook, Twitter, Instagram, and TikTok at Pain Nonprofit. And please subscribe to the Don't Hide the Scars podcast and share with others wherever you get podcasts and on YouTube. And if you would like to donate to PAIN, Parents and Addicts in Need, please click the link in the description to make your tax-deductible donation today and help us save more lives gripped by addiction.